Welcome, welcome, welcome. Welcome to the CJC online church platform. We have a wonderful program lined up for you today. This is Your Health and You. Remember, of course, we want you to like, share, and subscribe. So click on that notification bell right there in the corner. Make sure that you're notified every time that we go live. And of course, place this on your status. Today is for men, so we want to make sure, and women, we welcome you also. Well, please invite the males to come on over because it's about them. And what we're going to talk about actually affects so many men. At least every single man, if we live long enough, may have this problem. Your Health and You is a production of the Central Conference of Seventh-day Adventist Health Ministries Department, designed to present on health-related topics by sharing evidence-based information and naturopathic remedies. Your Health and You is aired every Thursday at 7:15 p.m. On first Thursdays, we focus on general health. Second Thursdays, we focus on men's health. Third Thursdays, we focus on women's health. On fourth Thursdays, children's health. And on fifth Thursday, mental health. And therefore, as we come, we are growing together, we are learning together, and we're sharing information. Let me just remind you that this program is for educational and informational purposes only and does not constitute providing medical advice or professional services. In fact, before entering and embarking on any health-related information shared here, make sure that you kindly seek counsel from your doctor or healthcare provider. In today's program, we will be speaking about benign prostatic hyperplasia, commonly called BPH, or otherwise known as an enlarged prostate. Before we dive into our topic for today, let's enjoy a reading from the book Counsels on Health by Ellen G. White.
Section 1. The World's Need. Multitudes in Distress.
When Christ saw the multitudes that gathered about him, he was moved with compassion on them, because they fainted and were scattered abroad as sheep having no shepherd. Christ saw the sickness, the sorrow, the want and degradation of the multitudes that thronged his steps. To him were presented the needs and woes of humanity throughout the world. Among the high and the low, the most honored and the most degraded, he beheld souls who were longing for the very blessing he had come to bring. Souls who needed only a knowledge of his grace, to become subjects of his kingdom. Then saith he unto his disciples, The harvest truly is plenteous, but the laborers are few. Pray ye therefore the Lord of the harvest, that he will send forth laborers into his harvest. Matthew 9:36-38. Today, the same needs exist. The world is in need of workers who will labor as Christ did for the suffering and the sinful. There is indeed a multitude to be reached. The world is full of sickness, suffering, distress, and sin. It is full of those who need to be ministered unto, the weak, the helpless, the ignorant, the degraded.
All right, I'm going to invite us to bow our heads and close our eyes as we have prayer. Our loving Father and our God who art in heaven, we are indeed grateful that you have spared our lives to see another wonderful evening where we can look forward to this great program, Your Health and You. We thank you for Health Ministries Director, Dr. Kemar Douglas, and his team. And we know, Lord, that this evening's program will be a tremendous blessing. We pray for our presenter who will share with us what you have laid on his heart for us this evening. And I pray that all our men, we will take our health very seriously. Be with this production, be with all those persons who are in the background working assiduously to make this program a success. And grant us your blessings, we pray, in Jesus' precious name. Amen and amen.
Celebrations, Temperance. When you hear the word temperance, the first thing you think of might be balance, or the ability to find a balance in life. But balance is a relative concept because everyone has different needs and priorities. In many cultures and communities, the word temperance has been forgotten altogether, a term from the past. Does it still apply to your life today? Look at temperance from a health perspective and you'll see it as something crucial. True temperance teaches us to dispense entirely with everything hurtful and to use judiciously that which is helpful. So you can see how temperance isn't a checklist of behaviors we should or shouldn't have. It's a way of life, understanding that in excess, even good things could be harmful. Taking stock of your own life, you might find there are areas lacking balance, sleeping too little, working too hard, eating too much, or not exercising enough, or even overdoing it. If you ever feel incapable of finding a balance, just remember help is never far away. God is always close to you. He will make sure you achieve and sustain a successful balance in life.
Every hour spent watching TV may shorten the viewer's life by 21.8 minutes. New research published in the British Journal of Sports Medicine tracked data from 100,000 Australians over the age of 25. They found that those who watch 6 hours a day can expect to live 4.8 years less than a person who does not watch TV, and concluded that watching too much TV is as dangerous as smoking or being overweight. That's a fact. But there's hope. You can extend your life expectancy by the push of a button, the TV remote button, that is. Consider alternative forms of relaxation and entertainment that reduce sedentary time and introduce more physical activity to your family's daily life. So don't wait. Turn off the TV and live a healthier and longer life.
Welcome back to Your Health and You. And we thank Dr. McLean, Barrington McLean, who did the prayer for us earlier. Dr. McLean is our men's ministries leader right here at Central Conference of Seventh-day Adventists. So thank you very much for coming on. This is indeed Men's Health, and we're very happy to have had our director for men, Dr. Barrington McLean, praying for us. Now, did you know that the prostate has two growth phases? Yes, the first phase occurs in early puberty when the prostate grows to the size of a lime, a large lime, if you want to call it that. I know you will hear per se walnut, but we're in Jamaica, and therefore we don't really know walnut size per se, which is about 1.5 inches to 1.25 inches. So let's use a lime. The second growth spurt occurs when they hit mid-20s, and it continues to grow throughout the remainder of a man's life. So an enlarged prostate problem almost always occurs during the second growth phase. Did you also know that most men will develop an enlarged prostate, but only 1 in 4 men aged 51 to 60, and less than half of those aged 70 and over will experience the symptoms that comes with an enlarged prostate? Of course, we will hear more about those symptoms a bit later. Prostate also secretes an antibiotic, which helps to protect the couple from infection. Do you know that? So the prostate gland secretes an antimicrobial substance that helps to protect the man and woman from infection. It's a very important organ. So we're going to discuss this organ. We're going to discuss an enlarged prostate or benign prostatic hyperplasia, BPH. We're going to go through all the things that we need to understand. And of course, we are very, very happy to have Dr. Keith Wedderburn. Now, Dr. Keith Wedderburn is a consultant urologist. So this man is somebody's experience. He understands what men face and how the treatment should be. He's now a retired doctor from the Cornwall Hospital after 28 years of service. But presently, he works for the Montego Bay Hospital and the Urology Center right there. He is married with 3 children and 3 grandchildren. And he is a Seventh-day Adventist, and he attends the Ironshire Seventh-day Church over there in West Jamaica Conference. Indeed, we're very, very happy to have Dr. Wedderburn with us, a man of experience, a man of the faith. He understands the dynamics of what's going on, and he's going to try and break down this malady that affects so many men. And therefore, we are very, very happy to have him. We invite you, of course, to make sure you place your questions in the YouTube comments section. We will ask those questions as we go through. So therefore, just type your questions in there and jot them down so we know what you're asking, where you want to go to discussion, and we will try and answer those questions as we go on. So therefore, thank you very much for being here. Make sure you click that subscribe button. Make sure you call a friend. Make sure you call your male friends and say, hey, you have to watch this program. It is key to your health. Place this on your status. And of course, we will be back with Dr. Keith Wedderburn right after these brief messages.
The Seventh-day Adventist Church Central Jamaica Conference, in association with Ebenezer and the Clear Park, Family of God, Spanish Town, St. John's, and Sydenham districts of churches, invites you to the Blessed Hope Evangelistic Series with international evangelist Jeffrey Harriott. Starting August 4, every evening at 7:15 except Thursdays, and then on Sabbaths at 9:15 a.m. under the Big Tent at 58 Brunswick Avenue, Spanish Town, St. Catherine. Come for health and wellness programs, prayer tower sessions, free weddings, marital counseling, soul-stirring praise and worship, prizes, surprises, and more. It's the Blessed Hope Evangelistic Series under the Big Tent at 58 Brunswick Avenue, Spanish Town, starting Sunday, August 4.
Hi, welcome back. Welcome back. It's time to dive into our discussion with Dr. Keith Wedderburn. Welcome, Dr. Wedderburn.
Thank you, Dr. Douglas, for having me on your program. Good evening, friends.
Good evening. Good evening. We're very, very happy to have you. Thanks for taking the time out to talk to us here in Central and to share your knowledge with us. Dr. Wedderburn, what exactly is the prostate and how does it function?
Okay, the prostate gland is a small organ found only in men. And this gland is located at the outlet of the urinary bladder in the lower abdomen. It actually is a sexual organ because it produces a fluid which actually nourishes the spermatozoa that the man's testes produces. Yes, and it also allows the sperm to travel in the fluid. So when a man ejaculates, the semen is made up of prostatic fluid and seminal fluid. The prostate also secretion, as you mentioned earlier, has antibiotics. It also has is alkaline, which actually helps the sperm to function because the female vagina is acid. So the alkalinity actually neutralizes the acidity, so the sperm can live longer.
All right. So it's a sexual organ that produces semen to help sperm survive, basically, in the environment of women.
That's correct.
All right. So what then causes what we know as benign prostatic hyperplasia or an enlarged prostate? What causes that to happen?
What we know for sure is that it is based on the male hormone. So if in puberty or before, the boy child loses both testes and is unable to produce male hormone, testosterone, when he grows up to be an adult, he will not have an enlarged prostate or BPH because the growth of the prostate requires testosterone, which is converted to dihydrotestosterone for growth. So if there's no testes, same thing happens because sometimes the boy may have damage to his testes in early life and his production of testosterone is decreased. So that we know for sure, that is hormone based. And it also happens as a man ages because the prostate grows. In fact, this is the only thing in a man that continues to grow until he dies. Other things stop growing but the prostate continues to grow. And usually the effect will be felt after the 4th decade of life, that is after 40.
So the effects is felt after 40.
That's correct.
So,
That's large BPH, yes.
so what are those effects? What are those symptoms that present after they hit 40?
Interesting that you asked me that, because a lot of men when they have symptoms, they say, okay, no problem, it's age related, and they do not seek medical attention. But the symptoms are divided into 2 groups. We have the obstructive symptoms, where there's obstruction to the flow of urine. And on the other hand, we have irritative symptoms, which are the effects of bladder response to an enlarged prostate. So when the prostate enlarges, it actually encroaches on the urethra. That's the tube that carries urine from the bladder through the penis to the outside. And when the urethra is compressed, then the urine cannot leave the bladder as it should. So for the man has to strain to pass his urine, and whilst he's straining, the urine comes, but it comes in very small amount and a very poor stream. Yes? And the other thing is that it will take him a longer time to empty his bladder. And when he thinks the bladder is empty, he dribbles. So there's urine dribbling on his underwear, and he has to stay a long time to shake his penis to stop the leak. The irritative symptoms are usually increased frequency. He has to pass urine often, and he has sometimes urgency, that once he gets the urge to pass urine, he has to rush. If not, he tends to wet his clothes. Then it may happen that when he goes to bed at night to sleep, he wakes up several times to pass urine. We can accept 1 or 2 times for a man, but sometimes he gets up 4, 5, 6 times. This we call nocturia. It progresses to symptoms in the bladder where there's infection. Because once the bladder is not emptying appropriately, there's a residual urine in the bladder, and this is a very nice atmosphere for bacteria to grow in. So he'll get a urinary tract infection. It may get so bad that he bleeds. So he may have passed urine. Yes, we call this hematuria. Now, it's very, very important for a man when he gets up in age. He needs to listen to his body, the symptoms, and get advice from his doctor, because there's treatment for this condition.
Wow. When I was in med school, one of the lecturers said that he doesn't understand why God placed the prostate where it's placed, right on the bladder, and then allow a tube to pass through, knowing that it will constantly grow and may lead to blockage. And he said it in class, and I had no way of responding to him. Why is it placed that way? Is there another reason why the prostate is placed where it's placed?
Well, we're fearfully and wonderfully made, and I'm sure God knows why he did that. Yeah? Because some people claim that when a man is young, he doesn't behave properly. So the fact that his prostate is placed at the mouth of his urinary bladder, it will control his action as he gets older. He won't be as, frivolous as when he was younger. So it is to control a man's activity. Yes? Whether that is good or bad, I'm not sure. But I tell you, when the prostate grows and becomes symptomatic, it can be very, very hard on the patient. Very hard. And the female in the family always sympathizes, because they're seeing what is happening, and their man who should be strong and fit is no longer that way, yeah? Because it can be a hard thing to cover.
Now, earlier when you described the symptoms, you said that he may have a weak stream. Practically, how does that look for a man? What do you consider to be a weak stream for a man?
Okay, usually when a man is passing urine properly, he can stand outside near a tree and pass his urine and hit the tree. Yes? That is
practice.
trunk of the tree. Now, when he has urinary obstruction from a prostatic hyperplasia, he stands on the tree and the urine actually goes onto his shoes. So he has to put his legs apart, yeah, in order for his shoe not to get wet. So that is what happens. The urine weakens. So he no longer can push the urine out as when he was a young man. It falls down onto the floor to wet his shoes. So that's a weak stream. And the time of the stream is also longer. He can't do a quick one. He has to stay there, and the stream is very slow until it finishes on its own. Even when he thinks it's finished, there's urine left in his bladder and will tend to drip until it's finished.
So he has a hard time starting and a hard time finishing?
That's correct. That's correct.
So Dr. Wetterburn, what causes the hematuria? What causes blood to be in his urine?
Okay. There are two things actually. When the prostate enlarges, the vascularity increases, and there are large prostatic veins on the surface of the prostate. And as I said earlier, the prostate is at the mouth of the urinary bladder. It actually projects into the base of the bladder. And these veins, when they're so enlarged, it's very thin, and they break easily. So when the man is there straining to pass urine, these blood vessels can break and bleeds into the bladder, mixes with the urine, and comes out. The second thing is infection. Because the bladder is not being emptied completely, there's always residual urine. Bacteria grows there and infects the bladder, and infection of the bladder can produce blood in the urine, hematuria.
All right. So most men tend to show up at the doctor's office when something is wrong with them and wrong with their sex drive, or they have erectile dysfunction. Does BPH affect sex drive and performance?
It can, because if the symptoms are there, obstructive symptoms, irritating symptoms, the man will have no interest in sex, because we know that sex is can be based on your feelings, yes, and also on your hormonal functioning. So if the man is not feeling well, if he has to go to the urinal several times, he may not have an erection because he's not well, yeah. But at the same time, testosterone is being produced, so he can get erection, yes, but it may not be as good as before. It doesn't make him impotent, yeah, but it will decrease the stiffness of his erection.
All right, so let's go to the part that most men may probably fear. How do we diagnose BPH or an enlarged prostate?
Okay, diagnosis is based on history taken, examination, yes, and lab tests. Now, usually in the history, we have to ask the patient, how is his urine flow? Is he having difficulty to start the urine flow? Is it dribbling? Does he have to strain? How long does it take to empty his bladder? Is he having frequency, passing urine a lot at nights? Yes. And does he have to rush to pass his urine when he gets the urge? So those are symptoms of bladder obstruction and bladder irritation. Then we do an examination. The examination is done with a gloved finger. The patient lies on the couch on his left side, legs drawn up, yes, and his underwear pulled down. The examiner, with a gloved finger, lubricate that index finger and place it on the anus. And very important, because not many examiners do this. Ask the patient to take a deep breath in when the examining finger is at the anal verge, and just before the finger goes into the rectum, you ask the patient to exhale or to breathe out. Now, this action of breathing out relaxes the perineal muscles, so the finger gets in the anus or the rectum easier without pain. So if the examiner is going to rush and do this examination, it can be very painful to the patient. So first, the breathe in, breathe out. Now that index finger can actually examine the prostate, which can be felt on the anterior wall of the prostate, of the rectum. We all know that the normal prostate at, say, a man age 40, 50 should be not more than 30 grams. Well, as you mentioned earlier, it could be the size of a lime or a guinea. It is normally smooth and rubbery, feels like a rubbery, right? Rubber and smooth. When the gland enlarges, it may still be smooth, right? But it's big, it's actually protruding into the rectum. Now, what we look for is the consistency of the prostate, whether it is soft, hard, which may suggest cancer. If it is very painful on examination, that may suggest prostatitis. So having done examination, the patient can be sent for a blood test. We normally do a PSA as a prostate-specific antigen. This usually rules out cancer to a certain extent, but not completely, because if the is very enlarged due to a benign prostatic hyperplasia, the PSA can be elevated. If the gland is inflamed, prostatitis, it can be elevated as well. So we have to take the examination and the PSA reading together to identify what we're dealing with. We can also send for ultrasound examination, a scan. So the ultrasound can actually pick up the size of the prostate in mils or milligram, and also if there's a median lobe protruding in the bladder that will or is causing obstruction. So when there's a median lobe, there's a high incidence of urinary bladder obstruction at that time.
All right. So in all my practice, I didn't know the breathing technique to relax the perineal muscles. So it's new. So you're actually educating me and passing on your knowledge to me. But the question that a lot of men don't like DREs. They don't like digital rectal examination. They feel that it's going to violate them, or they may have other concerns. So what would you say to a man to say, listen, it's not as bad as you think, and you need to actually do this exam, especially if you're over 40?
Okay. The fact is that the examination is a short procedure. In fact, Usain Bolt's record for the 100 meter is 9.8 seconds, yes? 9.8 seconds. And I can do a prostate examination in less than 9.8 seconds. So the patient doesn't have to say, oh my God, I'm going to be there on the couch and I'm going to be violated for 2, 3, 4, 5 minutes. No, it's a short procedure. And with the lubrication, it makes it easier. And I must tell the men who are listening that when the doctor examines the patient, the doctor is not getting any pleasure in doing that. So you do not think of the doctor violating you by putting a finger in your rectum. Presently, we have female urologists. So if you as a patient don't want to see your urologist, you have a choice. But it's very important, because if you only want to go and take a prostate blood test and don't want to be examined, yeah, the doctor may be missing something, and then you're at risk of dying. So it is better if you go through the short procedure and you're not being violated, because when you go to your GP, he will open your mouth and look in your mouth. He may put an instrument in your nostril, in your ear, yes, and will examine you. Women go for their pap tests quite regularly, and they're not being violated. So this is a normal medical examination, yes, and pleasure should not be thought of during that examination.
Thank you, Dr. Wedderburn. Your record of under 10 seconds is very fast, but of course you're a skilled consultant and have been doing this for a very long time.
Easier. Relaxation is easier. Yeah.
Okay. So once somebody's not been diagnosed with BPH and they have an enlarged prostate, so how are they treated?
Well, the treatment is based on the symptoms, because there are patients who come in for prostate examination or prostate check, and on examination, they definitely have an enlarged prostate, but they have no symptom. Yeah, they're symptom free. They can go through a day and pass urine twice or three times a day, once at night, and they're fine. No urgency, no frequency. These patients do not require treatment, because treatment, most time treatment have side effects, and we don't want to submit our patients to that. Yeah. Now, if the symptoms are there, we can actually help the patient to control the symptoms, such as don't drink alcohol or coffee, because this will cause increased urine production and will actually cause it to pee off then. Next, if you're traveling, if you're going on the highway on a bus or your vehicle, try not to drink anything before you hit the road. And at nights, drink nothing. Do all the drinking during the daytime when you have enough time to go to the restroom. The next thing is spices. Try and avoid spices, because spices tend to irritate it, and this can also cause increase in the frequency. If the treatment doesn't work, natural doesn't work, then we can provide medication to the patient. Presently, there are two types of medication that we offer. One of them actually relaxes the muscles in the prostate and at the bladder neck, so the urine can flow out freely, because once the prostate enlarges, the muscles tend to go into contraction. And when the muscles contract, then it is difficult for you to pass urine. These are called alpha blockers. Yes. The other set of drugs actually decreases the size of the prostate. Yeah. And these are 5-alpha reductase inhibitors, because the testosterone that I mentioned earlier that causes the prostate to grow, these medication prevents the testosterone from going into or converting to the dominant or the effective testosterone. We call it dihydrotestosterone. So if the Duodart or the Avodart blocks the conversion of testosterone, then the prostate will not grow. In fact, it will decrease in size, and that has been scientifically proven. So when these patients are placed on these medication, like Duodart or Avodart, it takes about 6 to 9 months for effects to be seen, and the prostate reduces in size and the urine flows freer. The alpha blocker, like Hytrin or Tamsul, actually relaxes the muscles, but it does not prevent the growth of the prostate. The size remains the same, but the muscles are relaxed so the urine can pass. And taking the alpha blockers is actually very quick to act. Action is within 24 hours, unlike the Avodart, which may take 6 to 9 months to be properly effective.
Do some men report that when they take the medication that they basically have issues, or they may have erectile dysfunction, especially with the 5-alpha reductase inhibitors?
Yes, I tell you, everything that is chemically placed in the body can produce side effects. Aspirin can cause bleeding from the stomach. Panadols can cause kidney problems. So medications are like that. So we as doctors try not to give patients medication if it's not necessary. But if it is necessary for your life or your health, we do. So in the case of 5-alpha reductase inhibitor, patient may complain of reducing their sexual proneness, yes? But if it is a man who has been going at 90% and is reduced to 80%, that most times not a problem. But if it's an older man, let's say 70, 75, 80, who's going just at 50%, when he takes these medication and reduce to 40 or 30%, then it's going to be significant. The alpha blockers does not affect the potency, but it can cause retrograde ejaculation. The men who are taking these alpha blockers will say in sex and at climax, just a small amount of semen comes out, and they worry. The semen actually goes into the bladder, and when you pass urine after intercourse, it comes out. And most men who are placed on this medication have had their family already and they don't want to have more children. But having sex is not a problem. They'll get their same turgor, same stiffness, climax, and the partner will accept that.
All right. So other than medication, is there any other treatment?
Before I go on to that, the alpha blocker a bit of dizziness. Yes, when you are sitting or lying down and you get up suddenly, then to feel dizzy. So it's advisable that when you're taking this medication, you must not just jump up. So at night when you're in bed to get up, you sit on the bed for some seconds before you get up. And they stabilize the pressure because the blood pressure falls. If there any other treatment that can be given,
Yes.
well, usually the prostate needs zinc for it to perform properly. And when a man has adequate amount of zinc in his diet, then it will slow down the growth of the. So there's a compound called lycopene, which is very has a lot of zinc in it, and we can get lycopenes from our food. So tomatoes contain a lot of lycopenes. Melon does contain a lot of, the red fruits contain lycopenes. And right now, I'm sure you can get lycopenes tablet or capsules, yeah, at the supermarket. But the thing is that if you try to eliminate red meat from your diet, because red meat like beef, pork, mutton, etc., they can actually increase the growth of the prostate. Yes, so we are meant to avoid red meat. In fact, if you can avoid animal products, it's better for you, because vegetables and fruit tend to help in the growth of the prostate.
Is there any surgical way of treating BPH?
Definitely. Not every man is going to require surgery, but the gold standard in surgery for prostate enlargement is we call this TURP, TURP. TURP, that's trans, U, urethral, R, resection, P of the prostate. So this is a surgical procedure where instrument is passed into the bladder through the penis, and the prostate is removed by electrical current. Yes. Now, this is one of the surgical method. Then we can do laser prostatectomy, where laser is used to remove the prostate. We can do open prostatectomy, where the bladder is open and the prostate is removed. Yes. And there are other methods which are not really universal, like vaporizing the prostate, heating the prostate. Yes. Do a urolift where the prostate is pulled to the side with a clip. Yes. But the thing is that surgeries can be done and surgeries are effective, but we don't just jump to surgery. If, for example, there are complications of the BPH, for example, bladder stones, that's a big complication, where stones are formed in the bladder. Yes, so if you have BPH, you have to think about that stone formation. Then you have repeated bleeding, and you can pass enough blood to drop your hemoglobin, and you can get repeated infection, which is another problem. And worse yet, if the bladder is not emptying completely and you have residual urine, there can be a back pressure on your kidneys, and you can end up with kidney failure, which may need for you to have dialysis. So even though most men think, oh, it's an aging process. I mean, I'm not a young man anymore. I can't hit the tree with my pea, but the side effects are dangerous and they can be lethal.
Wow. Thank you, Dr. Wedderburn. A lot to ponder. Men, you have to take care of your health. And if you're realizing that the stream is just not the way it used to be, or you're dribbling, or you have to open your legs when you're finished, or if it's on your clothes or on your underwear because it's just not coming out the way it should, and you have some urgency, you just can't hold it in. Men, it's best that you seek your doctor, seek a urologist, seek your regular GP if you must, but get checked out. There is help. At this time, we are going to take a little break, and when we come back, we're going to look at some natural remedies to help prevent or slow BPH or an enlarged prostate.
Cancer is one of the leading causes of death in developed societies. Each year, millions of new cases of cancer are diagnosed worldwide. Many of these cancer patients face a treatment regimen of surgery, chemotherapy, radiation therapy, or some combination. That's a fact. But there's hope. Physical activity can have a positive effect on undesirable side effects of treatment, such as pain and fatigue, as well as providing the benefits of body weight control, fitness, strength, and flexibility. One study showed that women with breast cancer who exercised while undergoing chemotherapy were able to lower their drug dose and had fewer delays during therapy. So, exercise more and have a happier treatment.
Welcome back. Welcome back. It's time now to look at our natural remedies. And of course, please place your questions right there in the YouTube chat. We're going to answer those questions shortly as we invite Dr. Wedderburn to actually present and answer your questions and the queries that you may have. It's a very important program because a lot of men are affected by an enlarged prostate, and some become symptomatic when their streams are not the way it's supposed to be. They start dribbling, they can't empty their bladder properly, and they end up having bladder infection. And of course, they can have kidney failure as a result. And therefore, because we don't want this to happen to our men, we want our men to be healthy and strong, even as they get into 100 years old. Therefore, we need to make sure that we take care of ourselves. Let's look at some natural remedies at this time that will help us to understand the dynamics and how we can help to ward off and slow down an enlarged prostate. That being said, let us just dive into some natural remedies that we can actually use. So there are two medical ways to deal with BPH when it comes on to giving allopathic medicine, giving them actual medication to slow it down. You have the alpha blockers that were mentioned earlier by Dr. Wedderburn, like tamsulosin, that relaxes the smooth muscles and therefore allow the bladder to void or to empty or for man to urinate easily. Then there's an 5-alpha blocker reductase inhibitor like finasteride, which actually blocks the conversion of testosterone to dihydrotestosterone, which is responsible for the enlarged prostate, or at least one of the reasons why we believe that you have an enlarged prostate. And therefore, when you get the medication, the 5-alpha reductase inhibitor, to block the conversion, therefore the prostate will begin to get smaller. Now, knowing this, there are some natural things that can be used, and Dr. Wedderburn actually mentioned one of the best ones that we have available, lycopene. Now, lycopene is a great way to actually help to reduce one's enlarged prostate and actually help to deal with some of the symptoms that come from BPH. Now, lycopene actually acts like a 5-alpha reductase inhibitor by actually blocking testosterone to dihydrotestosterone or DTH. And therefore, it's found in anything red. Any red fruit or vegetable is actually pretty good. And we just need about 7 to 40 milligrams per day. So red, anything red is of dire importance. Let me explain what I mean by that. There are a number of different things that we can use. And of course, the number one red fruit that has a very large quantity of lycopene in it, based on the actual volume, would have been guava. Yes, guava is actually very, very good. It does have lycopene in it, and it does help to, deal with the prostate. The next best one is actually tomato. Tomato is excellent. Regular sized tomato can heal you about 6 milligrams, is the standard right now for a regular size or medium sized tomato. Now, the thing about tomato, for it to really give you the benefit of the lycopene, because it's very heavily bound to the membrane, is to actually cook it. And lycopene is actually fat soluble. So when the tomato touches the oil, it has its best benefit to transfer the lycopene to you. So therefore, cooking a tomato is actually good. The other thing is that when you eat regular tomato, men or women, when you eat regular tomato, it tastes different. The cooked version versus the uncooked version, because when you cook it, it actually breaks the bonds and releases the lycopene. So it's important. And you'll find this in like tomato paste and in other things also, because tomato paste is actually cooked or placed on heat. And therefore you have a large availability of lycopene from tomato. It's actually very, very good. Now, I'm not going to say you go to eat pizza, because pizza is made with tomato base, and so is lasagnas. But it's actually a great way to get your lycopene, man. Other is white watermelon. It's a red fruit. It's available. It has roughly about 5 milligrams of lycopene available. So it's very good. And for another show, the green part of the melon is also very good, also, men. But that's for another show. Now, we also have grapefruit, and the grape I'm referring to is the pink grapefruit or the red grapefruit. The ones that we have here is not the one I'm referring to, which is normally the plain one or the regular one that looks like lime. So the pink grapefruit does have a lot of lycopene in it. And then, of course, we have our papaya, which is actually very, very good. It does have some lycopene in it, and you have your red bell peppers, and you also can have persimmon, and you have asparagus. We don't really have these here, but we do have red cabbage, which is very, very good. Red cabbage has to be cooked, of course, we know. You can eat red cabbage raw if you want, but the benefits of red cabbage actually happens when you place it on heat and allow it to seep a little bit. And of course, you have your mangoes. Yes, mangoes do have lycopene in it, but of course, if you're diabetic, please stay very far away from your mangoes. There are other things that give you lycopene. The good old Jamaican sorrel is lovely. In fact, even the hibiscus plant, the red flower from hibiscus, is also pretty good. And of course, you have your cranberries, you have your cherries, you have your panganuts. Yes, the red panganuts, lovely, it has lycopene in there. And I'm seeing here that another little quick thinking, what about red onions? Yes, there's also red onions. But the thing is that we're not going to eat the quantity of red onions to get enough lycopene from it. So these are the things that we tend to can consume a lot of. But red onions, though it has lycopene, it would not be in the quantity for us to actually consume it. But of course, red onions do have it. So any fruit or vegetable that is red is good. So I tell men all the time, once the fruit is red, enjoy it. I know sometimes we like to see the things that are kind of washed out or bleached out or, lose its red color. You don't really want that. And here in Jamaica, take advantage of your sorrel, take advantage of your cherry, take advantage of your tomato, take advantage of your panganuts. They're very excellent. Take advantage of your guava. And it does give you a lot of course, lycopene. And lycopene would actually help over time to reduce your prostate. Now, I must say that a number of studies were done on the effects of lycopene, and one from the New England Journal of Medicine, who said that basically they don't see a difference between lycopene consumption and of course, a placebo in their studies. But as Dr. Wedderburn says, you have to look at it because the drugs that are given, the alpha blockers and stuff like that, they do take a little while for it to work. And therefore, we have to also give these plant-based also a while for it to actually have the results. And most of the studies that were done within a year. There were longer term studies. Another thing that is known to actually help to deal with BPH is saw pimento. And we don't have it available here. It doesn't really grow the way we would want. It's a kind of dwarf kind of palm, but it's available in a supplementary form. And it's used because it says that it actually reduces inflammation. And therefore, inflammation reduction is important throughout our bodies. So it's actually good for that. And it also acts as a alpha blocker reductase inhibitor. The thing is that, once again, the studies that are done have not found significant benefits from saw pimento, but its inflammatory benefits are still readily available. And therefore, supplement is normally combined with another herb to kind of help to bring up the potency in dealing with an enlarged prostate. Another one that is available in supplement is actually Phygium africanum, which is a African plum. Currently, most of it comes from China, so it's no longer Africa per se. But Phygium is known to actually help to kind of slow down the growth of the prostate. And it acts also as a 5-alpha reductase inhibitor, which is what the medications would actually do. And that also is available as a supplement. Another thing that's readily available here in Jamaica, is pumpkin seed. Yes, the good old pumpkin seed is actually also known as, it has an ability to actually relax the muscle. So therefore, that's one of the medications that are used to actually relax the smooth muscles of the prostate. So it's known for doing that. It actually has 5-alpha reductase inhibitor specialities, so it can actually also stop the growth of the prostate and actually reduce the prostate size. And it had one added benefit. It has high zinc. You heard Dr. Wedderburn mention the need for zinc. It's very important, men. It is standard, men. Men, you need your zinc. And pumpkin seeds do have a high concentration of zinc. There's a caution, however, that zinc actually is also paired with magnesium and sometimes with phosphates. And phosphates don't work very well with those persons who have kidney issues, whether you have chronic kidney disease or you have acute kidney injury. Phosphates are not your friend. So therefore, you would have to also watch as you use this product. But that is your good old pumpkin seed. Now, let's go to some lifestyle. You heard Doc, so whatever I mentioned, no alcohol, that's a given. No red meat, that's a given. It's important that you avoid these things. And also, hyperinsulinemia does affect the IGF receptors on our prostate and can actually lead to hyperplasia and the introduction of new cells in our prostate, and therefore they grow and they balloon. So when you have too much sugar in your diet, it can be a problem. You can end up feeding the prostate cells and they will actually grow. So therefore, you need to avoid added sugars. Of course, you need to avoid simple carbohydrates. So therefore, you're going to avoid your white rice and stuff like that. You're going to avoid your white bread. Those things are not good. There are actually some persons who say you need to avoid bread completely. But for now, just avoid your simple carbohydrates. You need to avoid soya. Surprisingly, soya does actually affect, for men, your estrogen levels. So be careful of it because estrogen actually is known to promote certain growth. So therefore, you may need to avoid soya products. And we say, but you said avoid dairy, so what I'm going to use as milk. Men, you don't really need dairy products and you don't really need soya. You have other versions of milk, like your almond milk, that is actually pretty good for you. And therefore, yes, avoid soya and avoid dairy. And of course, intermittent fasting does help with your glucose and your hyperinsulinemia. So therefore, taking a little break sometime from eating for 16 hours, taking a little break, extend your break fast. So therefore, when you start fasting in the night, instead of eating directly in the morning and breaking your fast, you could extend your break fast to maybe lunchtime. And that actually helps to stabilize one's blood sugar level. So that's how you're going to help to reduce your prostate and actually deal with those issues. Those are your natural remedies. And of course, if your doctor says, hey, you need to take your medication to help with your condition, by all means, please do take it, because it's better that you actually have a reduced prostate and be able to go around normal than we have to give you a catheter or something like that to deal with your issues, or worse, have to do some form of surgery So we want you to take care of your health. That being said, let me just at this time bring back Dr. Wedderburn. And I'm going to ask one of the questions Dr. Wedderburn was posted on our YouTube chat is, does a prostate examination and a prostate check have to be done by a male doctor? Can any doctor do it? And I know you alluded to it earlier, but I also want to answer the question that was asked by Tarika.
Yes, the answer is that any doctor who is trained at a reputable medical school is taught how to do a prostate examination. Well, I tell you something. There are some men, they're actually the way they're built, they may have very muscular buttocks, and when the finger goes in the rectum, if your finger is not adequately at the proper length, you may not be able to feel the prostate because his buttocks, his gluteal muscle may actually prevent you from actually getting far enough in the rectum to feel the prostate. Yes, so this can be done by either a male doctor or a female doctor. And as far as the urologist is concerned, because the urologist does this more often, he or she is actually acquainted with how the prostate should feel, the consistency. And if there's any nodule or lump or anything in the prostate, then he appreciates that it is. And he may tell the patient that your prostate is not normal, so we need to do some other tests. Yeah, so that examination can be done by any doctor who's trained.
Excellent. Gregory is asking, does a colonoscopy tell everything about the state of the prostate? Is dribbling a symptom of prostate issues only? So it's 2% Gregory has for you. Number one, does a colonoscopy help to tell anything about the prostate? And number two, he's asking, does dribbling symptom, is it only for prostate issues alone?
Okay, colonoscopy is not used for prostate examination. Colonoscopy is used for the intestinal examination. So the camera goes through the anus and goes fiber optic right across to the cecum. And the cecum, transverse colon, descending colon, sigmoid colon, rectum is examined. Because the prostate is only the surface projects into the rectum. The camera that is used for colonoscopy cannot examine the prostate. Yes? So if you want a prostate examination, do not ask your doctor to send you for colonoscopy. As for the dribbling of the urine, not only enlarged prostate can produce dribbling of urine. If the man has a urethral stricture, say for example he damages his urethra, that's a tube from the bladder through the urine passes, whether physical injury or by infection. Very common is gonorrheal infection, gonorrhea. This can cause the infection in the urethra and results in a scarring, so the urethra strictures down. And the patient will present with obstructive symptoms similar to if he has enlarged prostate. Yeah? But examination and scanning will differentiate whether it's BPH or stricture.
Excellent, excellent. So is there anything that can be done to prevent getting this condition at all? Or is it that all men would eventually get an enlarged prostate?
Yes. All men, if they live long enough, will get an enlarged prostate. But not every man will be symptomatic. Yes? Because the way the prostate grows, if it enlarges with a median lobe, yes, and encroaches on the urethra, then that man will have early signs of obstruction. If the prostate grows posteriorly, that means it protrudes mostly in the rectum, that man may have a large prostate and still is able to pass urine freely. Yes? So it's the anatomical dysplasia of the prostate that causes the man to have obstructive symptoms.
Well, thank you very much, Dr. Keith Wedderburn, consultant urologist at the Montego Bay Hospital. And of course, we are very, very happy that you were here and that you shared your knowledge with us. Every month we focus on men's health on second Thursdays, and we're looking forward to having you again when we look at prostate cancer. So thank you, Dr. Wedderburn, for being here.
Well, my pleasure.
To our audience, thank you very much for being here. Next week, we have women's health issues that we discussed, and we're going to look at endometriosis. Yes, endometriosis. It is a plight on women, lots of pain, and most women don't even know they have it. So therefore, we're going to look at endometriosis next week, and we invite you to be here for that. May I encourage you, of course, to share this video. Send it to a friend, send it to the males in your group, send it to persons around, let them understand this condition so that if they are going through any symptoms, they can receive treatment early to deal with it, because we don't want to progress to the point where they have a urinary tract infection, or they have a kidney infection, or they have to even go under dialysis because their kidneys are no longer functioning. So therefore, I'm begging you, I'm beseeching you, share this program, like this program, subscribe to this YouTube channel, because here at Central Conference, we do care for you, and our programs are designed in you in mind. So it's here to benefit you. So make sure you play your part. Join us next week, Thursday at 7:15, when we focus on women's health, endometriosis. And of course, we close with our theme text, 3 John 2. Beloved, I wish above all things that thou mayest prosper and be in health, even as your soul prospereth. God bless you, and continue to trust in the Lord.
The Seventh-day Adventist Church Central Jamaica Conference, in association with Ebenezer and the Clear Park Family of God, Spanish Town, St. John's, and Sydenham districts of churches invites you to the Blessed Hope Evangelistic Series with international evangelist Jeffrey Harriott. Starting August 4, every evening at 7:15 except Thursdays, and then on Sabbaths at 9:15 a.m. under the Big Tent at 58 Brunswick Avenue, Spanish Town, St. Catherine. Come for health and wellness programs, prayer tower sessions, free weddings, marital counseling, soul-stirring praise and worship, prizes, surprises, and more. It's the Blessed Hope Evangelistic Series under the Big Tent at 58 Brunswick Avenue, Spanish Town, starting Sunday, August 4.